Hey guys, welcome back to Friends and Enemas. My name's Lindsey. I'm your host. And who do I have with me?
My name is Emily Knife, and I'm just so excited to be here today.
I'm so excited that you came down. Seriously, it makes me happy. I love your glasses.
Thank you.
I wish I had some now.
Oh, I should have brought you some. Maybe I'll leave these
Twinkie.
with you.
Okay. A parting gift.
Yes. I love it.
Well, can you give them a little intro of who you are, where you're from, kind of why you're here?
Yeah. So I am from Atlanta, but I'm from all over the world, really. I was born in England, and then came over here when I was 8. So I live in Atlanta, and I'm a nurse entrepreneur, so I don't have to really work in the hospital anymore, which is such a blessing.
Yeah.
And so I came in last night from Atlanta, and here we are.
Yeah.
On this awesome show.
Yeah. No, I'm seriously just so thankful for guests that come to me too. It's just makes it easy. And you made it here from, where are you staying in LA? Not that you have to, you won't be there by the time this airs.
Yeah, at the Westin, downtown.
Okay.
Yeah.
So a little bit of a drive.
Yeah, it was like an hour. It's not a big deal. It's LA traffic.
It's LA traffic. So, yeah. I know most people, whenever they drive to me, they're like, okay, I'll be there on time. And then I get a text. I'm like, it's LA, guys. It's fine.
It's like normal to show up late.
It's normal.
And that's how Atlanta is too, because it's the same traffic.
I kind of like that, though. Yeah. Like, I'll be here, so don't worry.
Yeah, I'll show up at some point. But yeah.
So going back to your nursing profession, can you roll us through when you started, where you started, and how you exited?
Yeah, absolutely. So I became a nurse in 2013. I got my RN in 2013, but before that, in 2011, I had gotten my LPN. So I started out in long-term care, wiping butts, scrubbing fingernails, doing the hard work. And a nurse supervisor was like, maybe you should go back to school. And I was like, I should, and I shall. So I went and got my ADN, and then realized that it was really hard to get a job. And I actually went to school for holistic nursing, which we know that's like not really a thing in the whole nursing world with insurance. So it was really hard for me to get a job. So I ended up getting a job. My first job was a director of nursing for a home health agency, and it was a Somalian population. And I didn't know anything about Somalians. I didn't know anything about anything.
Yeah.
And so I learned as we went, and we started at 0 patients, and in a year we had 236 patients. So it was really cool. I'm like, I don't even know how I did that, but we got there. And I went back to Ohio State and took 2 terms of Somalian, so I could learn how to speak Somalian. So I know a little bit Somalian, which is so weird. To speak it. They're like, wait, what? You're like this white lady. They're like caught off guard. Yeah, they're like, what? So I did that for a while, and then I just kind of job hopped because I just like didn't feel like I fit in anywhere, and my views are not like traditional nursing. I'm really into a lot of holism and holistic things that are kind of taboo in nursing, and so I just hopped from job to job. I did a lot of home health because I have kids, and I wanted to make sure I was able to like pick them up and take them to school. And then I did hospice for a while, which was really probably my favorite job. Yeah. It was such an honor being at the bedside of somebody,
I've heard that so much about hospice. When I was a new grad, I always thought like, oh no, I couldn't do hospice because like people are dying, but like people die in every sector of nursing. And from an ICU point of view, something I recognize quickly is letting them die with dignity, which is what hospice typically can do, is like just the best.
It's so the best. Yeah. And just even being there for somebody that doesn't have anybody, like that gives me chills. Like, it just like, it's just like you're that person there at the end of their time here on earth, and it's so makes me want to cry. But it's such an honor, and it's such a cool thing to be in that part of somebody's life. And for them to tell you their deepest, darkest secrets too. I mean, I've had people tell me some shit that I'm just like, what? Like, what?
I just started a little thing called Deathbed Confessions from like patients. I could read you a few. Do you remember any off the top of your head?
So the one that I do remember was this gentleman. He had a wife, and his wife passed away, and he's like, I've never told anybody this, but I need to get it off my chest before I pass away. And he was like, I cheated on my wife with like over 20 women. And I was like, oh my gosh. And he's like, I could never tell her, like, but I just needed to tell somebody. And I was like, well, thank you for telling me.
Yeah.
Like, that is, thank you. But that was the one that I really remember, that really stands out. But it's stories like that people just keep inside themselves.
Yeah.
And then all of a sudden you're the person. And I mean, I even get stopped in grocery stores sometimes and people are like, I have cancer. And I'm like, oh my God, let's hug it out. You know, like, let's get some soup.
It's like you have like a aura around you then, you know, like people are drawn towards you.
Yeah.
The one deathbed confession that I can remember off the top of my head was it's not good, but he confessed, she confessed to murdering her husband and she was never caught because the evidence didn't line up. And I was like, damn. But apparently he was really abusive. So I was like, well, I'm glad you got that off your chest, girl.
Dude had it coming.
I know. I'm like, well, don't be abusive, maybe.
Right. Oh my
we'll have it coming for you. Yeah. But I thought that, I was like, it just was interesting when you brought that up. I'm like, people just need to get it out.
Yeah. Yeah.
It's crazy.
Yeah. Get it off their conscious, you know? Yeah. It's crazy, like, to imagine how many people are running around with that kind of stuff.
That's something I thought too. I'm like, how many people have murdered somebody that's
not been
next to me at like a restaurant or something?
Right.
Like, it's interesting.
Yeah.
And then they have to tell it.
Yeah.
Like, oh. We also, when I was a new grad, we had a patient that was in the ICU and he had a really rough life and whatnot, but he also confessed that something that he had done, which I'm actually not going to repeat because it was just awful, and I was like, really wish I wasn't the person you trusted, but I don't know if I'm glad you got that off your chest, but here it is. You know, sometimes you're just that person that's there with them.
Yes. Yeah. And it's like the piece of nursing that it's like we listen and we don't judge.
Yeah, because we're there to be unbiased. That's what we're taught,
which is so hard.
Oh, it can be very hard. I mean, everyone has different views on anything and everything, so it's like
sometimes you just be like, oh
cringe. I'm still gonna take care of you, but I would rather not talk.
Exactly. Just shut my mouth.
So after hospice, where'd you go?
Yeah, so after hospice, I ended up going into academia, and taught in academia from like local community colleges to private colleges, and then ended up at Emory University in Atlanta and taught mental health nursing, which I absolutely freaking love. So in academia for a large part of my nursing career, and that shit is cutthroat, man.
Academia?
Yeah.
Is it more egos than like on a bedside unit?
You know, I worked bedside a little bit, like taking students in as a clinical preceptor, and I would say, the egos come out, but it's a weird like hierarchy. It's like the queen's at the top, the dean, and then you have like the jokers, and like it's like a chessboard, really.
That's so weird.
And the queen can move everywhere, but all the other pieces can't. They have to move like certain ways. And in order to like climb that hierarchy, you have to like kiss a lot of butt, and it's just, I'm like, that's like too much energy. That's just too much energy. And but I love the nursing students. I didn't like the culture or the non-collaboration, but I love nursing students because it's like they come in and they're so eager and fresh, and you can like mold them, you know, to be the most amazing nurse, and then they get the floor and they're like, why wasn't I taught any of this? Yeah,
exactly. They feel a little lost.
Yeah.
And that's something I noticed too with new grads is they'll be like, well, the book or the NCLEX said this, and I'm like, that's in perfect world, and that doesn't exist. You know, it is hard to grasp though when you're in that position. You're like, why was I in school for all that if that doesn't exist exactly how they told me it would?
And why does the IV not look like the picture that was on the wall? Like
why is their arm not as squishy as the one I was using?
And why can I not poke it a bunch of times?
Exactly.
But so academia was good, and then I ended up realizing that I could make money online. And so I actually wrote a program called the Somatic Nurse Coach, and it was originally for Emory. And so I put that online because I was told originally by the university, they're like, we don't want this, like this is not anything that we need. And I was like, that's bullshit.
That's annoying.
I was like, what? Like, you guys need this. And so I'm like, nursing students need mental health support. Like they need, but then in turn I was like, well, if all of our nursing students become aware, like truly aware, like consciously aware, they probably wouldn't even finish nursing school. They probably wouldn't even walk into a hospital because they would just be like, this place, I'm so aware. Like, I noticed that my nervous system's dysregulated, like the bright lights, the noise, you know, sensory overload. So yeah, they were like, nope, we're not interested. And I was like, boo-hoo. And I cried a little bit, and then I was like, and so I then ended up putting it out online and got like several students, and I was like, this is cool. Like, and I'm teaching people from all over the world, you know.
That is cool.
Where it's more, it's, you know, it's the availability to be able to provide that teaching to more people, which is really cool. Not just like a cohort of students at a brick and mortar college, which they wouldn't even paid me like what it was worth. And actually they told me, they're like, you don't have a doctorate, so you can't teach the class, but you could be the teaching assistant
of your own program.
Of my own program. But you could have somebody teach it that doesn't even know us, you know, anything about somatics.
That's annoying.
Kind of funny. Yeah. I was like, welcome to nursing.
Hierarchy.
Yeah. That's the hierarchy. Yeah. Yeah. So many times I'm like, I wanted to go back to college. I actually dropped out of doctoral school 3 times because every time I would make a sale online and I'm like, what am I doing again? What am I doing? And it was just because outside sources were like, hey, like, you should go back to school, you should get your doctorate, like, you really need to climb the hierarchy and be like a tenured professor. And I thought that was really cool, and that's what I wanted. And then I got in there and I'm like, this is toxic as hell. Like, this is not where I need to be. You know. And my light was getting dimmed. I even had friends that were like, you're not like your bubbly self, like, what happened? I'm like, nursing happened. Like academia, you know. So that's kind of where like I ended up in my last kind of term of real nursing. If you want to call it that. Traditional.
Traditional. Because I feel like we're getting away from, I think a lot of like soft nursing nurses. I don't know if they take offense to that term or not. But I love it. I love like, it. That's why I'm like, I love it. You shouldn't have to be recognized as a nurse just because you're working bedside. Like, if you're not working bedside, you're still a nurse. And like, shout out to LTACs. You said you started out in LTAC?
I didn't go live though. I didn't go live. For
a second I was like, what? Oh.
I didn't even have cell phone. I mean, back then it was like flip phone central, so you didn't have like all that social media business. But
I think social media, I love social media. Clearly I'm on it, but I also hate it. Like, it's a love-hate relationship, just because I think people they get lost in the social media sauce, and they just think clout is better than real life. I don't know.
It's like this invisible like reality almost.
And like, to be fair, I filmed at work and I got in trouble for it, and I learned, and I was like, oh my, I did not go live. I was not in a patient's room. I didn't have HIPAA by nothing. But it was against social media policy. And I'm like, oh, okay, that's something I need to tell all these other nurses. Like, we all think just because we see someone getting away with it for so long that you think it's appropriate, but it's just not. Just don't go live. Don't go live as a healthcare professional at work. I'm just like, no, girl. But LTACs, those nurses just deserve so much more praise and resources.
Oh my God, they do. LTAC and corrections. Yes. It's like they're the bottom of the barrel for nursing, and it should not be that way.
No, because we need both of them. Like, we need you really bad.
We do. Oh my gosh.
So you're talking a lot about somatic nursing. Can you kind of break that down? What does that mean?
So I created somatic nursing because I saw there was a disconnect. Like, so let me go back. We have neuro nurses, right? And they're like reading these cool telemetry charts and all that fun stuff. Well, I wanted to do the nervous system in a different way, in a more of like a subconscious level. And so somatic nursing, the reason why I started somatic nursing is because I saw such a disconnect of nurses just not being aware, like, or even just humans in general. Like, we're just so not aware of things. And I saw this disconnect, and I love somatics. I have a background in, like, I have my 500-hour yoga teacher training. I have a massage therapy certification. So I always like dabbled in the body and movement, and just kept seeing like how many nurses were so disconnected. So I was like, okay, I'm gonna go ahead and write this program. But somatics is diving into creating new neural pathways So like the neuroplasticity, I'm going to get really like nerdy and juicy
Love
right
it.
now, but I love it. And so, yeah, creating new neural pathways. So as nurses, like we have these horrible habits, like whether it's like drinking after shift or like getting in the car and like screaming. Those are all like habits that we do. And, you know, there's probably some of the viewers and listeners probably have habits that they're just unconsciously aware of and that they do just on repeat because it's a habit. So really it's about interrupting the habitual behavior that we do and changing it up so we can then create new neural pathways. So we're basically detouring the highway that we've been traveling on for so long.
You're kind of creating new, healthier ways of coping.
Yeah.
Essentially.
Yeah.
That's really
absolutely.
nice. Because going back to like new grads, especially new grads, I feel like aren't taught that there's going to be, it's not if, it's when, there's going to be a lot of toxicity in one way or another.
Yeah.
It's not always the same, but it will be there somewhere. And I think it's really hard to navigate.
Yeah.
And I don't think a lot of nurses, if any, I just don't think they're prepared, like you said earlier.
Yeah, they're not prepared. Yeah, they're not prepared. And like I wasn't prepared for my first death. Like I saw death. I'm a veteran, so I was in the Air Force as a medic, and so I've seen death, and like they kind of prepare you for it in the Air Force and like what that would be like, and they do debriefings. But when I had my first hospice patient, and I was there by myself, and I was like, holy crap, it's just me and this patient. Like, I was so scared. I was so scared because I didn't have the tools in place. And so the somatics goes back to like boundary, like learning how to say no, learning how to like look at somebody and be like, I have too much on my plate right now, and I'm sorry I can't do that for you right now, but maybe we can do something later, you know? And then also just like noticing your breath. Like our breath is our direct reflection of our nervous system. So obviously if you're hyperventilating, you're super dysregulated. But there's many times during the day that we don't even notice that we're so shallowly breathing, and that if you're not breathing, you're dead, right? So like we need to keep breathing and understand that that's a coping mechanism, and it's free. You know, it's like so there. And it's easier said than done. But again, it's the habitual like practice of noticing your breath, of being aware of your surroundings, noticing like if you're uncomfortable, you know, and voicing that, you know, and standing up for yourself. So yeah, I mean, somatics is like empowering the conscious and subconscious to either respond or react accordingly.
It's so interesting because when you break it down like that, I'm like, why wouldn't any academy or your school want to take that on? But I think you're right. It might might tell the nurses like, wait a second, what's happening over there that I might need this? But it's just true. Like we do need something like this to help us regulate back to a better coping mechanism. I think a lot of new grads do like the amount of crying, which crying is you know, let it out if you gotta cry. I'm a crier.
Same.
But
I mean, I cried last night when I arrived here because I came from Orlando. I was at like a think tank, and so I was already like you know, like, this is amazing. And so I flew from Orlando to here, and my car got canceled.
Oh my God.
On Turo, and I was like,
oh, no.
And it was like an hour like into my like before I arrived in LA, and they're like, we canceled your car, and I was like, sheesh. And so I'm trying to find another car, and then I couldn't. So I got to the airport, and I was like, just fucking hold it together, Emily. Hold it together. And so I took an Uber to the hotel, and I got into the hotel room, and I was just like,
you were stressed.
I was like, oh my God. I was like, yes, this feels good. And I got done, and I was like, yes. That's
what I needed.
That's what I needed. So yeah, it was good.
Stories like that when like new grads will apologize for crying. I'm like, girl, don't ever apologize. In fact, sometimes it works to your advantage, especially like if it's with a bully or someone. I'm like, no, cry. If you want to cry, cry. It makes them feel bad, as they should.
Feel so bad. Doctors just cry.
Just start crying. Make them uncomfortable.
Uncomfortable.
Like,
I love it.
Because I'll cry if I'm mad, happy, or sad. So like there will be tears.
All the emotions.
But I will use them to my advantage.
I love that.
You got into this because you noticed there was a space. This was obviously missing. But was there a certain trauma with your life or anything like that you were like, oh, ding, 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 light bulb, I need to do this right now?
No.
Okay.
Yeah, no, I have a shit ton of trauma.
Oh, okay.
Yeah.
Okay. I was like, oh, okay. Moving on.
I feel like we were just talking about this. I feel like all nurses, that's why they go into nursing.
Every time.
You know.
And you don't even know
Yeah.
it. And then you meet everyone else, you're like, you're pretty fucked up like me. We're both a little fucked up.
This is like just a big fuckery of people, like just trying to figure it out.
Yeah.
You know, that's like what nursing is.
Yeah.
But I struggled like all throughout high school with dyslexia, anxiety, all those things. I had like learning behavioral plans and stuff in high school and college, and got to nursing school and failed pharm like 3 times because I have number dyslexia. So I never really wanted to go into nursing where I had to give meds because I was afraid I would like hurt somebody. So I was like, I just need to stay away from bedside. But at the time, while in nursing school, they're like, bedside's the only option. And I'm like, that's bullshit. But yeah, because I was a late nurse. Like I was like 28 when I went into nursing school because I did the Air Force and lived a little life before. But yeah, I was lately diagnosed in my 30s with the funnest mental health disorder called borderline personality disorder, little BPD.
Interesting.
Yeah, little BPD. So, and BPD comes from abandonment. So either from parents or caregivers, and it really develops like all throughout your lifetime, but you don't really see it until like it comes into your 20s and 30s when you're doing like really crazy shit. And you're like, why am I doing these things? Like you kind of start questioning it rather than just doing it. And so I had like a lot of like funky relationships and was just trying to find my place in the world. And one day I was like, I need to diagnose myself. And so I went into Dr. Google and I was like, what is wrong with me? And they're like, well, you might have this. And I'm like, yes, I do. I fucking do. And so I went to a specialist that specialized in BPD, and they were like, you absolutely have this. And I was like, yes. And they're like, why are you so excited? This is like one of the worst mental health disorders. It has the highest suicide rate, but it's also the most curable because it's a behavioral disorder. It's not like a chemical imbalance or whatever. So as long as you learn behavioral skills. So I took it upon myself then. I went into outpatient therapy for 2 years.
Wow.
And learned dialectical behavior therapy. And it literally saved my life.
You love learning.
I
too.
love learning. Yeah. I love
That's
learning
really
everything.
Cool. Yeah.
Like I just got a unicycle for my 42nd birthday. Yeah.
Okay.
Because I'm like, why not? Why not fall? Why not?
For real, why not break my collarbone?
Why not join a circus at this point, right?
That'd be cool.
So yeah, I was like, why not?
Well, that's cool though. You're by talking about BPD, you're also breaking down the stigma, because how much stigma is around that. The moment you hear bipolar disorder, correct?
Yeah.
Bipolar disorder. The moment you hear that, if you're not well versed in it, a lot of people will be like, oh, yeah. Can you explain anything like that? Like, have you had what's the word? Like adverse reactions from people? Like, have people treated you differently before or after knowing that?
So let's differentiate first. So borderline personality disorder and bipolar disorder are 2 different things.
Yes.
But bipolar disorder shows up in borderline personality disorder. So because borderline personality disorder, honestly, it's like a collection of a bunch of different it's like the Fallout guy. It's like just throw a bunch of mental health disorders together and like that's what you are.
Yeah.
But yeah, for a long time, when I first got the diagnosis, I went online and I was like, holy cow, this is horrible. And it's the stigma. It's the relationships people have been in, books people have written about people with borderline personality disorder. It does not put you in a good light. And rightfully so. And it's because the symptoms are so severe, from impulsivity, from like driving erratically or having a lot of sexual partners, making just like impulsive decisions, depression. But the bipolar comes in because you do have like excessive energy. But the coolest thing about borderline personality disorder is that you feel all emotions, and you feel them like super, like say I got like an F in pharm, it would feel like somebody had died. Like that's the extreme amount of emotion that I would feel. So but yeah, going back to your question, I kept it hidden for a long time. And then I was like, no, like that's just part of who I am. And now I kind of say like I've been kind of undiagnosed because I don't have the like if I would go in right now and be like, hey, do I have this? They'd be like, you don't meet the qualifications, because I did DBT and I know how to regulate myself per se now.
You did the work.
Yeah, I did the work. You know, and I think diving into like psychedelics helped me. Using cannabis, holy cow, I will tell you, I was on 8 medications when I came out of the Air Force, and I was a zombie. And cannabis helped me get off of all those medications and was able to just like really dive into my life and actually live. Wow. So yeah, it's kind of interesting, and it helps with like the emotional regulation. Yeah. You know, it kind of helps dim it down a little bit so you can function. Yeah. And so I actually, I was high as a kite when I took the NCLEX because I had such bad test anxiety.
Oh my God.
Yeah, and I passed that.
Hey.
Flying colors. It like stopped at question 79. And I'm not afraid to talk about that because I think it's important that we break the stigma about that too. Like there's so many things.
So many things. Yeah. We could do a whole episode on breaking down the stigma, especially of gardening. Like that's what we call it now, gardening. Yeah. Like especially, side note, growing up like super hyper religious, I was terrified of anything like that, of alcohol as well at one point. And to be fair, alcohol has way more side effects than weed does, yet weed is still such a taboo topic in so many areas of life. And I'm like, and in nursing, we're allowed to get off work and go get smashed with mimosas, but we're not allowed to go smoke a joint and take the edge off.
Yeah, that's so weird.
Get your license stripped from that. I'm like, what? Yeah. I'm not high at work.
Exactly. And yeah, that's the problem, because if you get tested, you could have been high that morning. Right. The shift that you weren't working. Right. And then you come on shift and you're very functioning because you're not hungover because you didn't drink. Yeah. Like I would honestly rather have a nurse take care of me that was smoking a joint and a bowl the night before than went out and partied and drank 100%. And showed up at work at 5 a.m. because they just got off of a night binge. Like exactly.
Exactly. There's so many more benefits to weed as well. Yeah. It's a whole nother episode I would love to get into with you in the future.
Yes, that sounds good.
So how can your program help us? What's it called, number one?
Yeah, so the coaching is the Somatic Nurse Coach certification. Yeah. And it's just an 8-week program for nurses. And it's under $1,000. I wanted to make it very accessible to nurses. And it's honestly an investment in self. Yeah. And, you know, the people that go through it, their lives change in just a mere matter of weeks. They're like, wow, I didn't even know I was doing this before. They just become so aware, and they're able to change that. So there's quite a transformation. But the problem is nurses sometimes don't want to get better. Yeah. They just like staying in there.
It's just easy.
Yeah, it's easy.
Or more convenient.
It's easy not to do the work. Because when you do the work, shit's going to come out. And it's going to be rough. You know?
Oh, yeah. Yeah. It's just like with therapy, too. Like, I didn't want to do therapy at first for many reasons. But then as I was doing it, I was like, why am I doing this? Oh, I fucking hate that. I cry every time I need a nap afterwards. But as you keep going and you do the work, now I look forward to it. I'm like, oh. Yeah. And I don't cry afterwards anymore like I used to. Well, not every time, sometimes. Yeah. But not every time. It's not as exhausting because it has to come out. Yeah. And then you have to do the work. And then it gets better. It does. And that sounds like a lot like your program. Not saying you're a therapist, but you know what I'm saying.
But I feel like nurses kind of are therapists. I mean, people tell us their deepest, darkest, most crazy shit, you know? And we have to be like, I hear you. What are you going to do next? Yeah. I mean, we kind of are. We're therapists. We're social workers. I've been a fucking mechanic for this home when I had a home health patient. Yeah. Like, let me fix your car. You know, so it's like we're so many different things. Like we're not just a nurse. We're just so many things. Yeah. You can't even put a word on it. So,
yeah. Yeah. I totally agree with that. How do you think it could help us collectively as nurses?
Yeah. Are you talking about the somatics?
Yeah, your somatics.
Yeah. So collectively as nurses, you know, I really think it would change the whole culture, especially in regard to our leadership. If our leadership had emotional intelligence, which a lot of them do not, and Preach. I say that with very like poignancy, like do not, that they would learn how to incorporate collaborations and cooperation
Yeah.
with nurses, and show up on the floor, like be beside us and change somebody. Like those are the leaders that we need. And I think when we have nurse leadership that is emotionally intelligent and aware, then that trickles down to the nurses, and they can be like, oh my God, I can see that all my nurses are freaking burned out right now because I'm emotionally aware and I need to let this nurse go home because she's exhausted. Like that's emotional awareness.
Yeah.
Being emotionally aware of others and noticing how other people are doing. And that's really where the nursing leadership needs to start.
Yeah.
And we need to get the non-nurses, like they need to leave, like get out, like
The ones that are in leadership and they weren't nurses, agreed.
like get out. Or actually there was at this think tank that I was just at, one of the companies that came, the Ultra Human Ring, what they do is they have their C-suite walk through the actual like factory before they get into the office. And I was like, how dope would that be if we had our nurse leadership, like the executive of a hospital, walk through that ER. You go ahead and walk through that ER and you see, I mean, you might step on some pee. Who knows?
I hope you do.
I hope you get blood on your shoe, like on your pantsuit. Like, you know what I mean? So yeah, it would change the whole culture. It would change how nurses show up, and it will allow nurses to speak up and use their voice and actually don't stop, because voices are crushed so often, not just in traditional nursing in hospital, but in academia as well.
Yeah.
So,
and I feel like when nurses do speak up, it's when it gets shut down, it's like the leadership role took it personally, or with their ego, or that would never happen here. Yet you're right. Like, when's the last time you've been on the unit? You don't know. The short staffing is absolutely absurd. But then, like, someone told me this too recently. They're like, we don't actually have a shortage of nurses, but we have a shortage of nurses willing to work here in this. But what do the hospitals say? Well, there's a nursing shortage. It's our fault.
Yeah.
Again.
It's like for the last 10 years, there's been a flippin' nursing shortage.
How long have you been saying that? Like, shut up.
And
do something.
And the public thinks it's true.
They do. They don't understand it.
There isn't a nursing shortage.
There's not a nursing shortage. That was something I didn't even realize literally until a couple months ago. And I was like, what? Wait, what do you mean? I did the numbers. You go back, you find all the stats, and you're like, oh, they're just not willing to work in these conditions, which go them. We don't need to work in these conditions.
Exactly.
It's ridiculous.
Yeah, they're standing up for themselves finally.
Yeah. It's like, come on.
It's so great. Well, and I think the problem is too, like, just to piggyback on that, is that now these nursing programs are coming out with more programs, like acceleration like if you have a degree in 18 months, you can become a nurse. What? Like, what? You know, and Emory actually had one of the first MN programs, a master's of nursing. And they were having a hard time getting jobs because they're not traditional nurses per se. And they would show up at interviews and they're like, I have a master's of nursing. They're like, what the hell is this? And they're like, it's a new program. It was only 18 months long. And they're like, oh.
Yeah,
okay.
With no experience prior.
Yeah. It's like because they have like an interior design degree, it's like whatever degree they have, they weren't able to get a job or whatever. And so they're like, nursing sounds good. Here's an 18-month program. You get a master's, but you can't become a nurse practitioner. You would have to go get another master's, or you'd have to go on and get your doctorate. Yeah. Which is, so that just continuation.
It is. And any of those nurses, this is like making me spiral too now, thinking of, there was some post online about like our pay as bedside nurses overall is shit. Yeah. And we should be paid more as nurses, period. Yeah. Beyond bedside nursing, LTAC, everyone, corrections. And someone wrote on there, was like, you guys have a 2-year degree and you expect to be paid generational changing money or something like that. And I was like, girl, shut up. Number one, a 2-year degree is technically a 4-year degree. Yeah. We're one of the only professions, I feel like, I looked it up because I couldn't find it. I was like, is this anywhere else? Yeah, it's a 2-year degree, but it's actually 4. We need 2 years prereqs, 2 years nursing. Then the bachelor's is, it's only a 4-year degree. No, it's more, and it keeps on going. And I'm like, why do they do that to us? Yeah. And then the general public, once again, doesn't understand all of the shit we have to do. And that's because of TV too, I think.
Yeah, TV as well.
Grey's Anatomy.
Teachers, Grey's Anatomy, oh my God. And teachers are the same.
Yeah.
They still have to keep going back to school. And it's interesting. It's like female dominated
Every time.
Like, attorneys don't keep going back. No. Architecturists, whatever the fuck, like, they don't keep going back. Like, bankers definitely don't keep going back, you know? So it's like, yeah, why do they do this? It's one of the most stressful, it is the most stressful profession. But then you add, you're taking care of family. Oh, you should go back to school right now as well. And it's honestly, I feel like the reason why they do that is so you don't become still and realize the fuckery that's going on.
Oh, I think that's a great point.
You know, they just keep you going. They keep you in that trauma, fight or flight. So you can't realize that's where somatics come in. Because when I started doing somatics, I dropped out of my doctoral program at Vandy. I'm like, what am I doing? This is not. And I had to take an adult learning class. I'm like, what? No, I'm already doing like gamification for my students. Like, and you're teaching like networking. Like, this is what? Like, this is not 1970 anymore.
Right, you're behind.
They're so behind. Yeah, nursing education is so behind.
It's just, and once again, another woman-dominated field, nursing education. Education overall, but the nursing education, I'm like, tell us you hate us. Just say it.
Yeah.
Just say it.
Just say
Please.
it. Say it out loud.
Say it out loud. Do you think people should be going into nursing without therapy?
Ooh.
Or without knowing about somatics?
Like, there's things. Yeah. You know, I think it should be in court. Like, I think you should have to do like a mental health exam before you go into nursing. But then they don't like discredit you from not coming into the school. They give you a behavioral plan or something, some sort of coping skills or a class, like a pre-class before you go into nursing, like somatics, that you can learn all these things. So when you get into school and you're having a hard time in pharm, or you're having a problem with your co-student, that you can address those things and you don't feel like you're crazy. I think that a lot of nursing students, they're put under stress and they're like, there's something wrong with me. And it's like, there's nothing wrong with you. But then they got on all these like treatments and things that really probably aren't necessary. It's just because there's so much stress is involved. So I think interweaving mental health classes into nursing would be perfectly fitting for the current situation. Because we have trauma stacking. Like, you can't only build a Jenga tower so high until it starts to topple over, and that's literally what happens to nurses.
What is trauma stacking?
So trauma stacking, I don't know if it's like a term, I just use it.
I like it.
Yeah, it's literally the Jenga tower of trauma. And, you know, you can pull pieces out and your tower can still be standing, but you keep stacking, shit's going to crumble. So all of the trauma that we've experienced into our life up to this point when we start in nursing, it then starts compiling. So the trauma then you have in nursing starts adding on to your childhood trauma, your teen trauma, your young adult trauma. And it just keeps getting bigger. And then there's going to be a point where you're going to break. And you're going to be like, I'm burned out. I have a psychotic break. I feel suicidal. And that is when the Jenga tower falls.
Wow.
And so trauma stacking is a way that we need to get through to nurses and be like, okay, what's your ACE score? Because it's probably like a 10. It's probably like the highest of the high. And how can we navigate that, like, feeling worthy? A lot of nurses don't feel worthy. They don't have their own self-respect, you know? So I think that needs to be interwoven into education, into nursing education.
I love that so much.
Yeah.
I can relate to that too. When I first started as a nurse, I graduated 2018, was a nurse in 2019, and 2020 early, nothing to do with COVID, because most people go, oh, COVID, you were a COVID nurse. No, nothing to do with it. I had my lowest low. I was a bit maybe suicidal or very much close to ideation. Was not okay. We got me a doctor's appointment with you know, it didn't even go the route it should have. Somatics maybe would have helped me a lot. But depression, just very, very depressed. And when I would kind of open up to people, they'd be like, oh, it's because you're a nurse. I was like, wait, I think it's actually my childhood trauma, along with, like, you're right, this stacking of stuff that was never dealt with in the past, because we all have a life. We're not just nurses. We all came from something. And pain is relative, doesn't have to look the same for everyone. So we all carry some baggage. And then we come into this workplace that is like really toxic in some way, shape, or form. And then we're gaslit.
Yeah.
When we're like, so is everyone feeling like this, or is it just me? And they're like, no, that's just how it is. And you're like, awesome, okay, we're just gonna keep doing this. But you feel crazy. You're so right.
So absolutely crazy.
And that shouldn't be like that. Like, we should have something in there to be helping this new generation of nurses and the ones that are there now. Like, how great would it be to put in like a CEU for your mental health? That'd be cool.
That'd be so cool.
That would tell me you care.
Yeah.
You know?
Yeah. Instead of like diabetes. Nobody cares about diabetes.
I'm over it.
Get over the diet. Nobody's like, we're not even like, diabetes is getting worse. So obviously that shit's not working. Like, let's get rid of all the diabetes educators and fix our food supply. Right. Like, that's what needs to happen. And our portion. Like, it's not even like, take that out. Like, it's not even helping. So no offense to any diabetes educators. You guys rock. I love you, but you should find another job. But yeah, it's interesting. And I see nurses, especially when they come into nursing school, they're like, I want to be an ED nurse. I want to be an ICU nurse. I want to be this. And I'm like, cool. Do you even know what that is? And they're like, yeah, I saw it on Grey's Anatomy, or I saw it on some show. And I'm like, that is not what you see. That's not what it is, you know? And, you know, many times they get in there and they don't last long. And I think it's a problem because we're shoved into these boxes of like, find what you want to do. But quite literally, like, I don't think you really find out what and who you truly are till I'm turning 42 soon. And I'm just like, I'm just figuring this shit out, and like what I want to do and what I love to do. And my mental health has gotten better. My life has changed ever since I left traditional nursing. It's crazy.
And you've tapped into the somatics of everything. And something that just clicked for me too, like you said, a lot of us don't have or realize that we don't have like self-worth, self-respect. And it's a woman dominated field. And how long has that been happening to women? And I feel like we're just now getting into like an era where we're like, wait a second, we deserve that too. But you're right, I'm 32 and I'm like just now figuring out who I am, what I want, which can be ever changing. Who you are can always be changing.
You can always be changing.
But like, to know what you deserve just within the last couple years. And I'm like, wait, why did no one tell me it maybe is not supposed to be like that, but it makes sense that sometimes it takes a little longer because of our society, like how far we are from teaching stuff that actually matters.
And just like not memorizing for a test. You know, like if kids had somatics in elementary school, like if they became aware of themselves, there'd be less fighting, there would be less detentions, there'd be just more love and compassion there would be less bullying. I mean, they're really, because if somebody's like, you know, you're ugly, like even before they got that out, they would say that in their head and be like, I really shouldn't say that because that would hurt somebody, you know, but they're reacting to their own pain. And so they're picking on other people. And we see that in nursing. I mean, I was bullied at Emory, unfortunately. Actually, I had one of my bosses come in. They were like, you're teaching breath work for too long. That's not in our curriculum.
Oh, brother.
And I was like, y'all need to take a breath. Like, you literally need to take a breath. And they sat in on my class.
Wow.
And I was like, you can join in. Just join in. You need to.
Do what I do.
Do what I do. And it was literally like the beginning of class, and any of my students would tell you this, like, the first thing we would do is we would ground. We come into class because they're coming from like dropping their kids off that just like threw a shoe at their head. They're coming in from an abusive relationship. They're coming in from caring for their mom. I mean, I had a nurse that was sleeping in her car, you know, so like they're coming from all these things. And if we're showing them like, hey, you need to get grounded and just like center yourself before you start your shift, it starts in nursing school. And so they need to start learning these skills in nursing school.
Something you said that just reminded me of a nurse manager that confessed to me. She'll be on later in the season, but she confessed to me that she didn't realize she was going through the motions of like kind of what other nurse managers were doing. Like, you know, what did she say? When you come to work, it's work. Your life is, leave your life at the door. It's work. And
like severance.
Exactly. Like severance. You come here to work. We don't need to hear about your drama, essentially. And she regretted that because unfortunately there was a nurse who was killed by her husband. She was in a domestic abuse relationship with him for however long, ended up getting killed by him. And then when she found that out, she was like, oh my God, I could have been a shoulder to lean on. We could have been doing something for her outside of work. Nurse is not your whole life. Your whole life is outside of the hospital or wherever you work. And she's just like, had I had the emotional intelligence and awareness, not that I could have stopped it, but I could have been there for her. And I was like, damn. Damn.
Like to have that heaviness on your subconscious.
And she said it's forever changed her. Now she wants to know more about her people, you know. She's like, what are you guys doing? What are you doing after work? Well, you know, it haunts her. And it's sad, but it's like, what a awesome for someone to even come forward and be like, I did this and it was wrong. As a leader, I'm like, that's a true leader.
That's a true leader. That creates change.
Like, it does create change.
Action right there. Yeah, that's empowering.
And had, like you're saying, like if we were taught these things, like it would be that much easier.
Yeah. And I think nursing supervisors, especially like charge nurses, like they are kind of like out of it a little bit. They're kind of, it's the hierarchy again. It's the stupid hierarchy. And you see it. I teach somatics at one of the local elementary schools to the teachers because our teachers are so similar to nurses. And so I teach a weekly somatic class for them, and they love it. They're like, this is the best part of my day. And we do some yoga, we do some breath, we do some meditation. I bring my sound bowls in, and it's totally a good time. But, you know, they're the same. They're like, it's a hierarchy. And, you know, I can't have a workshop for both administration and teachers. It has to be either or, because the teachers will not speak up and out while the administration's in the room. Same with nurses. Same with nurses.
Fear of retaliation.
Now. I'm like, I'm saying it. Like, I don't care what you think about me, because change needs to happen.
Absolutely.
Like, you can't keep quieting nurses' voices.
I think that's kind of where I'm at too. I'm pretty over it. I'm like, you know what? If I get blacklisted from every hospital, at least I'm speaking the fucking truth, because they don't give a fuck about you. That's why you have to care about you. Fill your own cup. You know.
Do the things.
We got to change something. It can't go on like this. Healthcare's crumbling.
Which I think it should. Like, I literally am so excited for this crumbling. Like, I'm like, yes, get fired CEOs. I'm glad this whole insurance fiasco is happening, because it's bringing to light, like, the whole fuckery of basically them using us. They're using us as pawns. Like, it's really like this whole human experiment. That's what I feel like it is. And, so it would be really cool, like, if nurses could start building hospitals.
Yes, nurse-led hospitals. And like you said, it has to crumble to rebuild. And at first I was like, oh, no, it has to fucking burn down.
It has to burn down. It has to. And, you know, we're going to lose people because there's not going to be nurses taking care of patients. But I think we're going to start seeing more of this preventative care. This longevity care. Like, I love biohacking. Like, I'm such a biohacker.
I don't know what that is.
So it's like the longevity medicine. Like, you see, like, celebrities, like, looking super young and shit. It's from biohacking. So it's...
Teach me.
It's kind of there's different things that you can do. So there's like different supplements you can take that will make you look younger. There's a thing called like the super patch that I'm involved with. It's a vibro-tactile technology. Actually, I have it on my leg right here. You can kind of see it. They're little patches, and they do different things, and it basically interacts with your skin, which your nervous system is all over your skin, and it communicates with your skin. So it's like a little QR code for your nervous system, and it helps like reroute neural pathways.
Interesting.
So they have them for all different things, but I mostly use them they have like a skin one, a weight loss one for like calm, one for happy. There's there's a bunch of different things, but it's called vibro-tactile technology.
Write that down.
Super cool. Write it down. Write it down, people.
Write that down. Okay, so off camera, you brought up something called identity shifting, kind of letting go of imposed labels. Tell us about that. It sounds fun.
It's so fun. It's literally creating your ultimate version of yourself. Because what we've been combined up to this point is everybody's told us what we should be, whether it's our parents, caregivers, teachers, coaches, professors, like there's so many people, bosses, preachers, everybody. That's not us. And a lot of times we don't even ask ourselves, what do we want? What do I want to be? We rely on others, like, what should I do? Should I go to this school? What should I do? And we're always asking others. So identity shifting comes from a place of like reclaiming back your power and being like, no, this is like the badass that I want to be, and like truly stepping into that. And it's going to be really fucking uncomfortable, identity shifting, or quantum leaping as we call it. But once you start to quantum leap into your truest self, those labels kind of dissipate, and you don't really bring those labels up anymore. You don't identify. So like, I don't really say like, I have BPD or I have dyslexia. Like it's just not a part of who I want to be, what my future is, right? Like that's not my future self. My future self is ultimately this most badass person that's doing really big, epic things.
Yeah.
And so I'm stepping into that now. And I've been like, I'm not any of those labels. That's what other people said I was.
Yeah.
But who am I?
I love that.
Yeah.
Oh, it's almost like, maybe I'm wrong, but it's almost like talking to your inner child. Yes. Like, what did she want? Yes. What did he want? What did they want? You know?
Yes.
So how does one do this?
Yeah. So through somatics. I mean, it's a true self-awareness. Like once you are aware of what you want, who you want to be, then you can take the action steps to do that, right? It's like visioning. We are non-dreamers when we become adults. When we're kids, we dream and we have imaginary friends and we have all this cool shit that we can think about and vision. And as we develop and go into traditional education, they're like, stop daydreaming. That's bad. Yeah. But daydreaming is like you're visioning your future self, or you can, right? And so yeah, it's like just stepping into like who you're supposed to be before the world created this character that you're not.
Yeah.
Yeah.
I love that, before they started making you second guess yourself, essentially.
Yeah. And that's when people are like, there's something wrong with me. And it's like, no, because you're not actually living your soul's purpose. You're filling the boxes of other people of what they want, you know?
Wow.
So yeah, I mean, literally our life is like a bunch of boxes that we're just checking. And it's like, what if we start living outside the box? What does that shit look like? And that shit's fun. Because there's no rules. There is literally everything is made up. Like we were just talking about, this is not even real. Like this is not even, we're just like here.
Yeah.
Like we can make anything out of this. We can make it a really shitty moment, or we can make it a really good moment. And like life is just a bunch of moments together that ultimately make up who you are, and you get to pick and choose what moments you want to have.
Yeah.
So yeah.
I love this. You're right. It is a little bit like therapy, because it just reminds you to be your true self. And the moment you start stepping into that, it's hard to leave it. Like it's hard to look away. You're like, oh, wait a second. And you will lose people along the way.
You will lose a lot of people.
People that you think you're close to.
Yeah.
I haven't done this exactly, but like I've done some form of it, I feel like. Yeah. Like now I'm like, oh, I'm going to look at your class, because I'm like, wait a second, this is great.
Yes.
I think, but also the people that you lose, like, were never meant to be a part of you when you find your true self.
Yeah, absolutely. You know? Yeah, we shed, right? Like, you know, we talk about frequency. We're all energetically like sound. We're energetics, and our nervous system's energetic. Our heart is an energetic conductor. Like we're fucking electric. Yeah. Like we're lightning bolts just walking around, right? And yeah, so it's like when you step into a higher frequency, or you become aware of what you want and who you truly are, obviously people are going to fall away because you no longer reside in their frequency. If I look back at some of the past people that I kind of was involved in, they were a low frequency. Like they just talked a lot of shit, they had a lot of drama, and I would always just like kind of cringe. I'm like, why don't we talk about like cool things, like what our future looks like, and like the dreams we're having, and like these visions of this most epic thing that we want to happen for ourselves. But instead they're stuck in like this repeat mode, and it doesn't make you feel good talking about others. It doesn't make you feel good, like feeling shitty, like doesn't feel good. And that's where those lower frequencies lay. So authenticity is the highest frequency of self-expression. And when you step into that high frequency, you attract others that also reside in that frequency. So more opportunities, like ever since I've stepped into a higher frequency, I've had all these kind of opportunities like just come up.
Yeah.
It's super cool.
Okay, it looks like we got like rewriting your story, which I think has to do with, you know.
That's like the identity shifting.
It's part of it.
It's pretty much literally taking a piece of paper and writing down like what you want your story to look like. Because we reside in these repetitive stories of trauma. Like I could go the rest of my life and be like, I have BBD and I'm depressed. Like, okay, cool. But you can also be like, I love myself and I love all those pieces and parts, and that's who made me, but that's not who I want to be, and that's not who I am anymore. So anytime you can rewrite your story by rewriting your identity. And I literally tell people, like, just take a piece of paper out and like think of the most best awesome version of yourself and fucking write it down. And like don't be scared, because nobody's gonna see it, like only you. And when we start dreaming and visioning ourselves in a better place, we'll go there. Yeah. Right? Because if you think you're sick, you can make yourself sick.
Oh, 100. I totally believe with that.
Yeah. If you can make yourself sick, you can also make yourself well.
Yeah.
With better thoughts.
Yeah.
Yeah.
Yeah, because it's easy to dwell on negative stuff and continue down like this drain, essentially. Yeah. I love all this. I didn't know how much I would love it, but like now you're saying, I'm like, it makes perfect sense.
Yeah.
All of this does.
And the negative bias, like back to what you're saying, going down the drain, you know, humans, it's a negative bias because we're always looking for the worst in everything. And it's just how we're programmed, because we're programmed as hunter-gatherers. So we're like searching for like, is there an animal on the loose? Like, do I need to hunt it, or is it going to attack me? And so we still have that primal instinct within us, like to always kind of look out for the bad. But what if we're looking out for the good? Like, what is that? And that is definitely a habitual shift, because it's easier, like you said, to focus on the negative, because there is more negative in the world if you're residing in that frequency. But if you start upping up your frequency, you'll see that like there's so many good people. There's so much good happening in the world. And that's why I stopped watching the news. I'm like, I can't watch the news anymore.
I don't watch it either.
Yeah. Because I'm like, I don't even know what's going on. But my dad's like, don't you, he's like, I grew up with the news, like always on in the morning, like somebody just got murdered. Cool. See you later, Mom. Going to school. Like that's, like that was the 90s. Yeah. And news was always on. And my dad's like, but you don't know what's going on. I'm like, I don't need to know. It's not affecting me at this moment. Yes, I know what's going on around the world, but I don't need it every day in like these huge doses of this fuckery, because it messes with my mind.
Absolutely. And if it's not that, it's something else every single day. If it's not whatever topic it is, it's something new. Bringing up like the negative. When I think about negative comments that I get, I could be like, oh, somebody said this and da-da-da. And thank God my husband's like, but how many comments were there? Let's just say 100. And 2 people said that. Pfft, who cares? Who cares? I'm like, oh yeah, you're right. You're right. But it's so easy to be like, but this. And when that's like the people pleasing, like these people, A, don't know me. Yeah. B,
Joe Blow 69,
who
man. Like, he's wearing a cowboy hat.
Okay. Anyway, that should have been my first red flag. I'm like, oh, next.
Like it's not, somebody that's like respected, right? That's saying this stupid shit. And it's the same goes for when I worked in academia, the nursing professors, whenever we got our end of the quarter reviews, it would be like awesome comments, and then one MFer would be like, your class sucked. And I'm like, I have a 4.9 now. Exactly. It's like, but who cares? Like that doesn't even, like, grades don't matter. That shit, ratings don't matter. Like I know that I'm a good teacher, right? Like I have fun, it's a good time, and cool. If you don't like the way I teach, thank you. Have a good day.
Yeah. And honestly, you can't be liked by everybody.
You can't.
You really can't.
You can't. I think if you're doing something right, you're gonna have that negative Nancy or Joe Blow 69 coming on and ripping, roaring at it.
Exactly.
Because they lack self-awareness.
They do. Because they don't know they're emotionally intelligent and not unintelligent.
Yeah, they don't know it.
Like,
they're so lacking in awareness. Yeah.
Oh, so one last thing I've thought of too is whenever you tell someone like, essentially like, well, you're not educated in this, that the way that hits them in the chest.
Yeah.
I'm like, well, but you're really not. I'm not trying to be a dick. You're just not.
Yeah.
So like, we should take that away. Like, if someone tells you that, not in a hateful way, but like, oh, are you educated in that, or what do you know about that? And they don't. Like, okay, then stop talking and listen to other people. Listen to other people's experiences and what they've done. I'm like, God, that was just a random rant.
But no, you're right. Like, you're a human. Get curious.
Yeah.
Instead of being on the defense, just be like, get curious about it.
Yeah.
Like, we are all learners. Like, that's the human experience. Like, fucking learn a bunch of shit and then die. Like, and be okay with it. Like,
and then die. You will anyway.
You're gonna fucking die. But yeah, like, just, you gotta, like, I think because I've been in a place where, first of all, I've wanted to end my life so many times, and that's why I have so many tattoos, is because I've had so much pain, and tattoos relieve that for me.
Yeah.
It's almost like a form of self-harm, I think, in a way, and we don't really look at that in mental health as a form of self-harm, but it is. It's kind of like cutting. So yeah.
Now that you're saying, I'm like, actually, yes.
Yeah. Any of the listeners, think back to a time that you got a tattoo, and think about the before, what happened before, and then why you got it. Like, some of my tattoos are obviously, like, I got one after nursing school. Traumatic, yes, but also a great experience, right? Like, I have some of my kids' art. Birth is traumatic. Like, it really is. Like, my body is my story, but it's also a way of relieving emotional pain.
Interesting.
That's why I got tattoos. So,
I mean, it makes sense, actually.
Yeah.
For me, too. I'm like, oh, actually, now that you say it, yeah. If I'm upset, I'm like, maybe, it's a good time for a tattoo.
Yeah. Yeah. Like, it's very, like, the needles, the sounds, and the feel. Like, I'm like, I fall asleep during tattoos.
I do,
so
too.
Calming. Yeah.
Except for, like, when they hit, like, a bone. I'm like,
yeah.
But
like,
other than that, it is pretty calming.
Yeah.
That's an interesting take.
Yeah.
So is there anything else we need to hit for you?
Yeah, I think so right now we're throwing, like, epic festivals called Modern Nurse Fest around the country. Our first one's in Anchorage. Well, we had one back in October. That was my baby, and I did that all by myself online. Had over 300 people attend.
Wow.
We had like 24 speakers, nurses, and we talked about, like, microdosing, psychedelics. We had cannabis nurses on. We had legal nurses on. We had nurse entrepreneurs. So I was, like, trying to hit all of the things that we just don't talk about in nursing. And so we're throwing the first one in Anchorage, Alaska in September, which will be so dope.
That's so dope. Cool.
Yeah, 25th and 26th. And then from there, we go to, like, we're going to Orlando and Sacramento and Houston. And then in 2027, hopefully we'll be, like, international, like, I don't know, London or Australia or some shit. But yeah, it's cool because we wanted to do it. Like, we're tired of these boring conferences. We're tired. Yeah. We don't want any more PowerPoints.
I'm so over it.
Or pantsuits. We want to wear fucking sweatpants. Okay. And so the Modern Nurse Fest, it's a community festival. So, like, the public's allowed to come in, which is so cool because who doesn't have a family as a nurse? Like, we have significant others, we have children, right? So why not bring them in to see what we do? Because a lot of times, like, even when I ask my kids, they're like, I don't even really know what you do. Like even my spouse, like, he's like, I don't even know what you do, I'm like, what the heck, but they just see, like, scrubs and stethoscope on TV, and that's what they think mommy does, So I really wanted to bring in the community and do something for the the state nurses, because a lot of nurses can't travel to these conferences. I mean, some of these conferences cost like $5,000. Yeah. Which is stupid.
It is so stupid.
Like, why? Like, I would rather go to the Caribbean and get shit-faced. Not really, but smoke a lot of weed, you know what I mean? Exactly. And enjoy my vacation, then pay to a weekend to go sit with a bunch of stuffies.
For seminars.
Yeah. Seminars.
Oh my God. Count me out.
Yeah, count me out. So Modern Nurse Fest, you still get CEs. We're hooking up with RN Renegade, which have pod classes.
Very
cool. So they'll be hooking us up with all the speakers that will have a pod class.
Wow.
And that's the way you're going to get your CEs.
That's super
Yeah.
cool.
Yeah. But we have the first biohacking ever in nursing. We'll have biohacking there. We'll have
That's super cool.
a cool like innovation lab for nurse entrepreneurs, like to help them start their business. We have a book nook for nurse authors.
That's awesome.
We're going to sell like erasers and shit, like a traditional school, you know, like the book fair back in the grade school.
That's cute.
Like there's just so much goodness. So we're having a wellness area, like yoga, meditation. And the thing is, every place we go to, we get local sponsors. So like we have the amazing, one of the gyms up in Alaska is going to be providing some of the movement classes with like their instructors.
That's
right?
cool.
So yeah, it just gives nurses like an opportunity to see like what they could be and what it can be for nursing.
And what's around them.
Yeah, what's
to
around
utilize.
them. Yeah, because this is a literal, like, it's a cultural shift.
Yeah.
Like, I'm done. I'm fucking done with conferences. Like, I'm tired of it. Like, we're
love
not
that.
doing it anymore. So, I love music. I love music festivals. And it's such a great place. Like, I always feel so good when I go to a music festival.
That is so, I've actually never been to a music festival, but I'm going to my first one this year.
Where are you going?
We're going to When We Were Young. It's October. It's like a bunch of punk rock bands from like early
Like emos
2000s.
and stuff? Yes, I know. Yeah, I've heard of that one. Yes.
We're going for our anniversary, and I'm like stoked because I've never been to one.
Oh my God, you're going to love it.
I can't wait.
You're going to love it. Yeah.
But you're bringing that into nursing.
Yes. Yeah, we're bringing it in nursing. And, you know, it's like it's a celebration of nursing and everything that nursing is. Because it's usually like neonatal nursing conference, psychiatry nursing conference, OB. Like, shut up, we're all nurses. Like, why can't we all just get together and have a cool time, you know? And we're doing a little things differently. So I've been dry actually I just had a drink because I was like, maybe I should have a drink. And then I felt like shit after I did it. But I wasn't drinking for a long time because it was just like not making me feel very good, you know? So we're going to have a whole like mocktail situation. We're coming out with a cookbook for Modern Nurse Fest, like where nurses can send in their recipes. So like lots of fun shit.
That's true community.
Yeah.
That's what you're
nursing
doing.
is community.
Yeah.
There's if you ask a person, like if you know a nurse, they're going to be like, yeah.
Of course they do.
Like the house probably next door hasn't, you know, it's like
they are a nurse.
There's so much, exactly. Like there's so many you know, and it's like they're embedded into our community, but the community doesn't even know what they do because they're not allowed in. And so this gives community the privy to walk through the career fair, the exhibitor area, and just see like what nurses are into. Maybe they want to become a nurse. We'll have people that can sign them up. Maybe they want to join the Air Force. We're going to have like armed forces there. Like it's incredibly epic. Like I mean, I can't even tell you like how fucking excited I am.
Dude,
like,
props to you.
Thank you.
You created this.
Yeah, I created it in October online, and then Jen was one of the speakers, and she's like, this is cool. Why don't you bring this to Alaska? And I was like, well, fuck yes. Why not?
Say less.
Say less. I'm there. I don't know how I'm going to get there or how we're going to do this, but we're going to do it. And so it's literally just, we've had so many people, like we have Nurse Fully, which is like a mental health, like psychiatry for nurses, that brand. We have Moxie Scrubs as a sponsor. We have all these awesome, we have Nurse Nurse B&B as a sponsor, you know, so it's like we're getting all these cool big name like people that are just like, yes, this is amazing. And like, this is what we want our brands to be, you know, put in front of. So yeah, I literally wake up every day and I'm like, this is so fucking cool. like I was saying, like, I think like, I just want to live. I've been in such dark places before and I just wanted to die so hard and not be here anymore. And now like all I want to do is just fucking live. Like let's live, be like, let's like go skydiving, let's get a unicycle, like let's just do all these cool epic things because that's what humans are supposed to be doing.
Absolutely.
You know?
We're supposed to be coming together.
This is supposed to be fun.
That's cool.
We're not supposed to be like hating on each other or fighting each other. Like we're supposed to be collaborating and like building things, and like that's what we're supposed to be doing.
That's what it's all about.
Yeah.
Dude, I'm so excited for you. I would love to go. That sounds fucking cool.
Let's do it.
Especially the one in Alaska. I was like, Alaska's on my bucket list.
Yeah.
And you said that, I was like, wait, maybe there's.
Yeah.
That's cool.
Yeah.
I'm so excited for you.
Yeah.
I will. depending on the dates.
Yeah.
You said 25th, 26th, and I was like, okay, we need to look at that.
Yeah, come and
My
speak,
birthday's
man.
the 26th.
Oh, shit.
So maybe it's meant to
Maybe
be.
it's meant to be.
See?
You can come and speak, dude. Just come and speak about
What
something.
would I even speak about?
Everything. Just speak about everything.
Maybe. We'll talk.
Yeah.
We'll talk.
We'll figure it out.
We will.
Yeah.
Well, if you guys want to go, the link will be in the description.
Yeah.
Where can everyone find you?
Yeah, just nursesfornurses.org or modernnursefest.org or .com, depending on what your spice is feeling. Yeah, I mean, nursesfornurses.org is probably the best place. We have a platform called Heartbeat RN where it's basically just taking all the nursing silos because everybody's like out in BFE and we're like, come into our community and just like hang out. And so it's a community of a bunch of entrepreneurs, a bunch of coaches, a bunch of people that were like literally lost and now they've been found.
That's so cool.
So yeah,
it's like your whole brand.
Yeah,
I love that.
Yeah, it's community. Like that's what it should be. Community. We shouldn't be in competition, which we're so taught in nursing school. Like, what grade did you get? Oh, I got an A. I got a D. Oh God, what happened? You know, and it's like we're not putting like in team effort when we're in nursing school, but we're then expected to work as a team when we go into the nursing like world.
Yeah.
And you can't because you haven't been taught that. And so there's lots of competition over collaboration. And I'm big on collaboration just from being in the Air Force. Like that's what you work as a team. And like if somebody's down, you like say like, what the hell's wrong with you? Like, let's go, you know, what's going on with you? And so that's something I brought in, and I've noticed that with other veterans that I've worked with, they have a team mentality, and that just carries over. Like, we're just all in this together.
Yeah, that's how it should be.
It should be like that. Yeah.
Well, dude, I'm proud of you. That's so cool.
Thank you.
I love that so much. I'm so glad that you came and told your story and then told what you're all about too. Like I said, the links to her website along with the link to go to Nurse Fest will be in the description. So that's all. You got anything else?
No, just thank you so much. This
You're
is so
welcome.
dope. Yeah,
You're welcome.
Amazing. Thank you.
You're welcome. Bye, guys.
Bye.